You're listening to Conversations with Shonda, a podcast that unpacks the community's grittiest, most vexing problems, hosted by Shonda Smith Baker. Today, we're thrilled to welcome two outstanding guests who are also twin sisters and third-generation Minneapolis residents. Dr. Rachel Hardiman, a professor at the University of Minnesota School of Public Health and director of the Center for Anti-Racism Research for Health and Equity. We also have Simone Hardiman-Jones, Executive Director of the Green Light Fund Twin Cities. Both are dedicated to building a more equitable world. Enjoy the show.
Welcome to Conversations with Shonda. Thank you so much for being here.
Thanks for having us.
Yes, you are welcome. So what I love about this podcast is that it for sure fills my cup. What I love is the messages I get back from the listeners that say what they've been inspired by, what they've learned and reflected on that's impacting their own leadership and how they're being pushed to think differently about how they're making a difference in community. And so I'm looking forward to hearing back from listeners on the inspiration they feel from you two as sisters, as twins in the work. And so I just want to start out just talking about like family and leadership because it's the obvious place to start with you. And I have a family that has been very embedded in this community and making a difference. And our families have crossed paths over generations. And so it's just in your family DNA to be impactful and doing the work. Like, what is the evolution story that you all want to share?
Go ahead, Simone, since you're firstborn, you can start.
I am firstborn, oldest by 20 minutes, so I'll take it.
Wow, okay.
Yeah, I mean, so I believe are third generation Minnesotans, deeply rooted in Minneapolis, South Minneapolis to be exact. And, I feel privileged every day to be a part of and come from a family with such a long legacy of public service and community organizing and people who just are all about affecting change, particularly for Black Minnesotans. And we have really had the privilege growing up to listen and learn and watch our family members, our grandparents, both paternal and maternal, our uncles and aunts, our parents, our mom and dad in particular as well, who really have, I think, shaped who we are and what we do and why we do the work we do. Our grandmother in particular, Ernestine Belton, was a force to be reckoned with. She was I think, self-described community activist and organizer. No was not a part of her vocabulary, and she held those expectations for us as well, and really, I think, modeled for us how to lead in community, how to ask for things, how to demand and expect the best, and really, politely and respectfully question authority in order to create change. And so we've really had this privilege of really learning and listening from amazing leaders who we've grown up with and who have taught us a ton.
So I would just add, I think everything Simone said is exactly right. I reflect all the time on the shoulders in which we stand, and I know that we would not be here and not have this platform if it weren't for our ancestors. The other thing I was going to say is the other day, Simone and I were talking, we were at an event at the Boys and Girls Club annual gala where our father, John W. Hardiman III, was being honored for his lifetime of dedication to the Boys and Girls Clubs of the Twin Cities, and listening to the stories that former members of the clubs and former staff and, mentees were telling about him and who he is and how he shows up and leads with love and compassion and, really has dedicated his life to serving our community. And I turned to Simone at the end of the program and I said, well, we never actually had another choice, did we? It was so clear, even though I didn't realize it as a kid. We just knew, like, this is what our dad does. Our mom, worked for Minneapolis Public Schools for years. And, even as kids, like, we were always surrounded by, extended family. And I don't mean like blood relatives, but just kids and teenagers who needed a home, needed a hot meal, needed to go on a camping trip. And so, from day one, it was just very clear that we were part of community, that that collective action was part of our DNA and who we are. And so when I think about like how I got to where I am now, it's like I never, in many ways that path was paved by the role models and our ancestors who came before us.
Yeah, I love that. And congratulations on that recognition for your father and the expansion of the Boys and Girls Club to V3 Sports, where my son is the executive director and he has an opportunity to be what would be the word I was going to say, entangled, incorporated into the legacy of your family once again, in terms of the expansion of the Boys and Girls Club there, that it will be named after him, that is named after him. And, one of the things that has always struck me here and why I like going to other places where Black communities have been is that we don't often have things named after us and streets named after us where we can go in and we can touch the legacy of what that means. I do think that we underestimate the level of inspiration that brings and connectivity over generations. And so just congratulations to your family for that. But I think it's important that we honor the legacies.
Yeah, absolutely. Yeah, I know, I completely agree. And, obviously our dad hasn't done the work all these years to have a Boys and Girls Club named after him. And yet, even now, we're a couple months out from the big announcement and he's still like every once in a while, it's just like, I can't let go out.
Yeah.
The impact and and that legacy is so important for our kids, for my daughter Layla and Simone's son Leo, to be able to see that and know that what they are a part of, I think is just as important.
Yeah. My son Leo said to me, "Mama, when am I going to have a building named after me?" So already that seed is planted.
I love that so much. My uncle, as you both know, was Dr. Richard Green. And I often share that some of the best leadership lessons I had was witnessing his leadership. And it was like around my grandma's table, and it would be him fiercely arguing with his colleagues. Right. And they would be arguing, like yelling, right, about no, no, and, you're crazy. And they would be going round and round about things. And then they would walk away and they'd be like, well, I love you, man. And like, good luck on this decision. And what I learned from that is that leadership is not about agreement, but it's about surrounding yourself by people that are going to challenge your ideas, that are going to push you to be your best, that having sort of a circle of champions is really, really important. And doing that in a way that's connected to your whole self, right? It wasn't that he was at work and having these conversations. He brought him to the table and allowed me to witness it in ways that has given to me over many, many years. Can you share maybe an example of what it did? Because there are many people out here doing great work and questioning whether or not they're doing the right thing with their children or their families. I know y'all probably think that too, but what might be some lessons that you can reflect on that you got around those tables?
So I can start. I think about this, and this is something Simone just, said in talking about our grandmother, Ernestine Belton. One of the things, the lesson I watched her teach over and over again was that you never take your first no. And that there's always a path and you have to be willing to dig in and also find the people to support you and and getting to where you want to go. And I think that lesson has translated for me working in leading in academia, where the bureaucracy is what it is. If I had taken my first no, I would not have gotten into grad school. If I had taken my first no, I would not have launched a research center, right? And so I think being bold enough, like that lesson is like being bold enough to say like, okay, this may be what you're saying now, but I'm gonna, find that workaround, or I'll come back to you with a different question or a slightly different, or I'm gonna find the other person to talk to or ask that question to, has been, one of the most important lessons that I've watched many in our family teach in a lot of different ways.
Mm-hmm.
And I think related to that, growing up, we often were sort of challenged around, okay, you've identified this problem in our community, or you don't like this thing going on at school, or you saw this happening. So what are you going to do about it? What is your plan to respond? And, back then I didn't realize that was building my advocacy skills and my, passion fueled my passion for public policy and politics, and it really built a pathway for my career, the early part of my career. But in that moment, it was really about, okay, you see a problem in our community. What are the steps that you can take? What is in your control to respond or to create change or to make that thing different, have a different outcome or impact. And so I always think about our fifth grade project where we had to identify a societal problem and come up with a way or a plan to respond to it. And I chose to start researching it, chose to respond to this problem that I uncovered with a large company that was sending baby formula to countries in Africa, many of which did not have clean water, access to clean water to make, to mix the formula. And as a result, millions of babies were getting sick, and in some extreme cases dying. And actually, it was our grandmother who said, okay, so now that you've discovered this problem, what's next? How do you fix this? How do you solve it? What are your steps? And I launched a letter writing campaign to that company, calling out their unfair and inequitable practices. And, again, I didn't know that was sort of laying that seed of my next steps into working in politics and in public policy in Washington, D.C. But that's exactly, what that did for me, and also encouraged what you said, that healthy debate, those conversations, the art of compromise, and understanding, your power and what you can do about it.
Yeah, what I love about those stories is often, as parents or those that are supporting kids, we want to come in and solve the problems for them. And there's so many things that seem familiar to me, right? Of even my mother saying, "Okay, well, that seems like a problem. Tell me what your approach is going to be," right? That really helped me have confidence in my own decision making. You guys both have touched a little bit on your career journey. I would love it if you could just take a moment and just share just the highlights of your career journeys and some key milestones.
Go ahead, Simone.
Sure. Yeah, so I alluded to or mentioned, having or starting my career in politics and policy. I left Minnesota to go to college. I went to school in Washington, D.C., and really had an interest in politics. I don't know that I had an interest in public policy at that point, and I don't know that I really knew what that meant, but was excited about campaign work and politics and learning about how to affect change. And so I post undergrad and grad school, I spent some time working on Senator Amy Klobuchar's very first campaign for U.S. Senate. I was the director of African American outreach. And so I did a lot of work with our community, with the Black community, and connecting folks to her campaign. And that work really resulted in my going right back to Washington, D.C., and being one of the first staff hired in her U.S. Senate office. And I had the privilege to work on education policy as an education policy advisor to Senator Klobuchar, as well as a senator from North Carolina as well over the years. And then I had the honor of serving in the Obama administration. I served for the last 4 years as an appointee in the Obama administration, working on education policy in particular, and really fighting to ensure that Black and brown kids, students with disabilities, students from low-income families had the best education that we could provide them from our perch at the federal government and federal level. I was instrumental in negotiating and reauthorizing the largest federal education law, known as the Every Student Succeeds Act, formerly known as the Elementary and Secondary Education Act. And it was an honor and privilege to work for President Obama and his team. And then I decided it was time to come back home. I missed Minnesota, and it was really coincided with my husband and I starting our family and wanting to be close to my sister and my parents and other family members. And I also knew that coming home for me meant finding an opportunity to create change in the community that raised me, and also knowing that this was the place where I would be raising my, at that point, 8-month-old son. He's now 6 years old. But knowing that this was where we would be raising him, I also deeply knew that I needed to take on a role that would make our community stronger and better for particularly for Black boys like him. And so I had the honor of accepting a role, and this is in my current role as Greenlight Fund Twin Cities Executive Director. And Greenlight Fund is an organization that invests in community-led change. We, at the root of all of our work, really, it starts with our community residents and community members and understanding what the needs are so that we can respond with innovative programs that meet those community needs, and also creating the cross-collaborative partnerships that are needed to really ensure that, one, those programs are responding to the needs that we've identified in partnership with community members, but also having an impact in the way that we see the needs being. And so excited to share a little more about that, but would love for Rachel to hop in too.
Okay. So my path is different. So I think I always had an interest in healthcare that was sparked by the many hours that Simone and I spent in the dialysis center with our grandmother. As children, we would sit there and do our homework, and we, watched her interactions and experienced her interactions with the healthcare system. And while at the time I didn't sort of know what the bigger sort of picture was of what that, what I was seeing there, I did know that someone having to spend that much of their life engaging with the healthcare system, particularly at like a middle-aged, young age, our grandmother died quite young, due to her kidney failure, and the choice she made to discontinue dialysis. And really what I reflect on now as her taking her power back and deciding that she wasn't going to be beholden to a system that didn't seem to want to fight for her and love her in the ways that she deserved. And so for me, the path there was healthcare, was becoming a physician. I went to Xavier University of Louisiana, a historically Black college that is known for training the most, or preparing the most Black undergrads for the medical field and for public health. And then after graduating from Xavier, I had the opportunity to study in Cuba at the Latin American School of Medicine for 2 years with this plan of really becoming a physician. But what I learned within like 6 months of my time in Cuba was that health is actually not, it's certainly the healthcare encounters and that medical care is an important piece of it, but health happens in so many other ways. And health is really about the relationship you're able to have with the healthcare system, with your physicians. It's about policy, health policy, social policy. It's about access and using the levers of policy to provide access and high quality care. And so ultimately, I decided and realized that a pathway where I could contribute on a macro level, meaning, really thinking about how do we change our policies. One of the stories I always tell about my time in Cuba was watching how the primary care physicians who are embedded in community in every neighborhood. So within a 2-3 mile radius, there's a physician, and they live above the clinic. Everyone knows their names. They know everyone's names. They're going knocking on, so-and-so's door, checking their blood pressure, checking their blood sugar. They know who's pregnant, and there was this relationship, right? And this feeling of we're all in this together and, of mutual love for one another that very clearly fueled how a provider was offering care, and also how the healthcare system was operating. And I was like, why can't we do that in the US? We could do that. And so I decided to come home and go to grad school where, I did a master's of public health in public health administration and policy, and then a PhD in health services research and policy with plans to then go work at a think tank and, develop the research and evidence base to inform policy. What I didn't anticipate during my time in my doctoral program was that I never had a professor who looked like me and who shared my lived experience. And I started to ask where are the Black women in academia? And ultimately decided to take the path of academia because I figured if not me, then who? And now I'm laughing because I'm at this point in my career where I'm like, was that the right choice? It was, but it was, but it's been hard. It's been incredibly hard. I went from being the only U.S. born Black student in my doctoral program to being the only U.S. born Black, or actually the only Black professor in my department. I was the second Black professor to be hired in the School of Public Health at the University of Minnesota. The first one was hired nearly 30 years before me. So between that and between when she was hired and in 2016, there was no one. Mm-hmm. And then in my work as a professor, as a researcher, as an academic, I've really focused in on, over the past decade, on the notion that racism is a fundamental cause of health inequities in our society, and that we have to be willing to do some really hard stuff to change that and to dismantle that. And that's the path to health. And from there, that's how we get to liberation, is really the philosophy sort of behind my work. And so I've spent I've spent a lot of time over the past 10 years building knowledge in the field of public health and health policy around racism and how it gets under the skin and makes us sick, particularly for Black and Brown birthing people and their babies. I think the other three notable things that I'll share is one, I rose through the ranks of academia unusually quickly. So typically, for those who are unfamiliar with how academia works, you're hired into an assistant professor position and you're on the tenure track. And typically it takes, from the time you start on the tenure track, it takes about 6 to 7 years before you're allowed to go up for tenure. And once you go up for tenure, then you become an associate professor with tenure. And then after that, it's about 7 to even like 12 years before you become a full professor. I did all of that. I went from a postdoc into an assistant professor position in 2016. And last year in 2023, I became a full professor, right? So what takes people 14 to 20 years to do, I did in 7. And I don't say that for like a pat on the back, right? I say it because I think it's important to be clear about the toll that takes on one's leadership ability and on one's mental health and well-being, but also because like I came in and I was like, okay, this is a system. I mean, and when I reflect on what I've learned, also from, many of our family members and leaders who have come before me, it's definitely been, I've learned a lot about strategy and how to engage in systems, not even just engage, but to thrive and do well in systems that were never built for us to thrive in as Black people. And I think I've been successful both because I care deeply about the work and am committed to getting it done and improving things. And also because I have learned a lot of skills around sort of how to do that in a space that wasn't necessarily comfortable with me being there. In 2021, I had just become an associate professor with tenure, and I was reflecting on what I wanted to do next. Actually, this was 2020. And I started like writing this vision. It's one page with this vision of what would it look like to have a research center within the University of Minnesota or within an academic institution that has anti-racism in the name and that is actively working towards building the evidence base to dismantle racism and its impact on health. I put that one page vision in front of one of my colleagues at the School of Public Health, who then put it in front of Blue Cross Blue Shield of Minnesota. And a few months later, got a phone call saying, Blue Cross Blue Shield of Minnesota is going to gift you $5 million to launch the center. So we launched in February of 2021. And essentially, I have been building a startup, which was not part of the leadership training I've ever had. But I've been building a startup since then and really trying to think about how we can do this work differently. I have a lot of lessons and reflections that are probably better for another conversation.
Yeah. And the center is the Center for Anti-Racism Research for Health Equity.
Health equity, yes.
Yeah.
And I refer to it as my love letter to our community. I intentionally wanted to build it and create it here in Minnesota, for many of the same reasons that Simone just talked about for why she wanted to come back and have an impact here. And then the last thing I'll say, as I think about my career highlights, is, I have always worked hard to make sure that the research that I'm conducting and producing and publishing doesn't just sit on a shelf. I'm not here to just generate knowledge for the ivory tower, but really to make sure that what we do is being used and can be implemented and can inform policy. And so last month, I was named as one of Time Magazine's 100 most influential people in the world due to a nomination from Congresswoman Lauren Underwood, who has used my research over the past 10 years to help inform how she's writing policy and legislation to pass the Omnibus Act and other policies around improving maternal health outcomes for Black and Brown community members.
I love it. And congratulations. There are so many threads that I can go down what you just said. And we're over here as like the Amen choir on the softer side of the accomplishments. And so one of those things were, you moving through space in which you were the first, the only, the few. Mm-hmm. And there are people that hear that and instantly recognize that experience. And there's others that are listening that are like, why is that even important to know? Like, what does that even mean? What strategies do you have to develop to do that work? And so we were all nodding our head. And so, Simone, I don't know if you have anything to add in terms of ways of being that you have to be thoughtful about as you navigate in space that has supported you being successful that you could share.
Yes. So as Rachel was talking, I was thinking back to my time on Capitol Hill in Washington, D.C., sitting in rooms and spaces, negotiating legislation, particular legislation focused on supporting Black and Brown kids. And I was the only brown person in the room. Oftentimes I was the only brown person in the room. A lot, even more so, there was hardly ever anyone in that space who closer to the ground in schools, educators, leaders, people who, are doing that work even more closely to the students that we were trying to support. And, I often, so for me, that was a lot of pressure. I felt like then, okay, I am now representing and having to sort of advocate in a different way, and on behalf of, a population of people. And these are big, decisions that are getting made. And again, to Rachel's point, different structure, different system, but again, a system that was not designed for our presence, for the presence of Black and Brown folks. And so being thoughtful and strategic and was a part of sort of my daily path, my daily, thought process to be able to, say the things that need to be said, but in ways that, would lead to the outcomes that I knew were important than that we were looking for. And so, I think that really stands out to me as an experience, but also, I am now in a space of, philanthropy. Again, another system that was not built and designed for Black folks. And, I go about my work every day, unapologetic about supporting the Black community in the Twin Cities, and deeply believe that my work through Greenlight Fund Twin Cities is about affecting change and starting with the Black community and looking for ways to do that and opportunities to invest in programs that will get results and have a difference for Black people. And so, again, another space where I'm constantly thinking about and strategizing and being thoughtful about how we do our work, how I go about my work, the decisions I make, the partners I bring in, the collaborators that I know will make a difference, and frankly, other funders who are willing to get on board and support the mission and the work too.
I was just going to add, when you said, there's people, listeners and folks out there who don't actually even understand or know what it means to be an only in these spaces, for me, it's been a experience of being highly visible yet invisible at the same time, which I think for a lot of folks doesn't make sense. But the example I often use is I have been, because of the work that I do, because I've been incredibly successful in publishing my research in some of the best journals literally in the world. My institution gets to benefit from that. And so you'll see a poster of my, with a portrait of me, as you walk into the building or our office buildings. And there was and so I'm highly visible in the sense that I am, always sort of the face of the work. And yet as I stood outside of that same building while there was someone on the inside of the building standing next to this massive photo of me refusing to unlock the door to let me in because they felt like I didn't belong in that space. Even though if they just turned a little bit to the left, right, they would have seen it, same person, right? Clearly, clearly I belong here, but they wouldn't let me in. And at first, the response was like, well, I didn't see you. And then it's like, no, we made eye contact. Um, and it was like, well, I didn't know that you worked here. And so I think that's just one, and it's, while that seems like a very small sort of encounter, many of those over weeks and weeks and months is really hard and really, and I think it's painful. One of the other things I think about is early on when I first joined the faculty at the University of Minnesota. It was in 2016, and Philando Castile had just been killed by a Falcon Heights police officer. And I was sitting in my office just distraught. I did not know Philando, but what I did know is that he was a beloved community member, just like all of us are. And that pain just couldn't, I couldn't even work. And, I'm sitting and, going throughout my day in meetings, and people are like, what's wrong with you? Like, it was business as usual for everyone else. And so being the only in that space, that is one instance of sort of the damage that happens where there was no acknowledgement, right, of what was going on outside of the walls, right, of our office. And when I think about I was also going to say I have a colleague, Dr. Monica McLemore, who always talks about the fact that being an only, as a Black woman in particular, in these spaces is unethical. Because of the damage and the wear and tear and the weathering that occurs, and also the inability to then be productive and to get the work done that you feel so passionate about and care so deeply about. And I think to your other question, Shonda, around like, what do you do? Like, what do we do about that? I mean, this is like, I think we have so much more sort of, and I'm thinking about this from like an institutional, organizational lens, and that, this is a systemic issue where we really need to step back and sit with what power means and who gets to have power, because that's where the decision making is happening. And and also I would say, and so that's on like sort of the big broad general level. I will say that I think here's what gives me hope is that I was the first in my department. I was the first Black faculty member in my department. And now there are 4 of us, 4 Black women who are on the tenure track or tenured. Well, I'm the only one tenured, but the others are on the tenure track in that same department where I was the only being trained. I was the only for about 6-7 years. And so, but what I think changed is not necessarily that bigger change, that systemic change that we need, but that I think my colleagues saw me and they're like, okay, it is possible. And so collectively, we've been like slowly building that critical mass, and it's slow and it's hard. And it also means you're going into some really honest and hard conversations with folks about like what they're walking into. And, but I think that honesty is part of like actually has helped, even though I'm like, it's not all, sunshine and roses. And also, if we are, if we see ourselves as a collective, if we see ourselves as building a critical mass, we can do it together.
And I see that also in in philanthropy, and I've really loved and enjoyed following the Voice, Vision, Values conversations that you're having, Shonda, as well, with Black women leaders in philanthropy in particular, who have come together to say, this is what we're experiencing. Here's how we can be support for each other, but also here's how we can make sure that this doesn't continue for the next generation of leaders coming behind us? And how can we, support each other and also have an influence and change the way that the people, Black women in particular, are experiencing this field. And I think there's a huge opportunity to continue those conversations in particular. And then also, what does that look like for organizations that like foundations and other philanthropic organizations are supporting? How can we more intentionally focus on Black leaders and Black organizations as well?
One of the things that is striking to me in all of the issue areas, whether or not it's education or academia or policing or any of these things that have sort of threaded through this conversation, is that the amount of work it takes to have people believe the experiences of people is incredibly disappointing.
Yep.
That I've now gotten some years behind me in this field, right? So whether or not it's, what you were talking about, Simone, of being in the work and being near the ground, right, in your policy work, right? And folks are always talking about the neighborhood that I'm from, North Minneapolis, and they're talking about parents from here while I'm parenting kids, while I live here, in the schools that they're talking about. And they have the solution, but they're not even asking my opinion. And so I both have a positional power, but at the table, not really the power. It's very weird, right? It's sort of like, what is the strategy to get people to understand my experience while also having the credibility? Like there's this dance that happens, right? This dismissal of experience or this knowing that happens. That I think is really, really challenging. And so one of the things that I know, Rachel, you've talked about is, and I'm looking here, but in terms of like anti-racism work is really about love.
Yeah.
And I think it's sort of the thread of what we've been talking about. And could you share a little bit more on why that is? And I think I know where you're going with that.
So I realized early on in my career that if I'm going to be studying and speaking and talking about health inequities, that really what I feel like I'm doing many days and feels very unsatisfying to me is trying to convince people of our humanity as Black folks. And I realized, particularly right after I had my daughter, gave birth to my daughter, but also, as I was doing this work and thinking really about the connections between police violence and living in communities that have experienced police violence and its impact on birth outcomes and maternal health outcomes, that, if we start from the notion, that every single person who is a victim of police violence, whether we deem them to have been doing something quote unquote wrong or not, does not matter. They are someone who is a beloved and loved community member. And then also on the other side of that, we are a community watching that beloved person be harmed, and that's harmful to our health. And so I started really digging into this question of how does living in communities where we're watching this structural violence happen erode our health and well-being, but also our ability to be, or how it perpetuates the narrative that we are less than human, right? That we aren't worthy of love. And so after George Floyd was murdered, my husband and I, who's in the healthcare field as well, and a colleague, we wrote a commentary called Stolen Breaths that was published in the New England Journal of Medicine. And we talked about sort of the reality of George Floyd's murder and what that loss means from a health perspective and what our healthcare systems need to be doing to make those changes. And we also talked about the pandemic and the literally stealing of Black lives through COVID-19. But we started and we ended that piece by very clearly saying both Black people are loved and George Floyd was and is loved, because we felt like it was important for our colleagues who are, health researchers and healthcare providers to remember, right, that we are not talking about statistics. We're not talking about data points. We are talking about real lives. And, part of also the work that I do, I'm analyzing data all the time and reporting, statistical analysis, but I'm also very clear, and as is the rest of my team at the center, that behind every data point is a family. It's a person who was loved or is loved. And also, when I think about this work from the reproductive justice framework that we use, which is that everyone should have the right to have a family and create a family or choose not to. But most importantly, that we all have the right to raise our families and build our families in safe and sustainable communities. And to me, that starts with love. And so I really try to ground even the most scientific of talks that I give in this notion of love, because I think that everyone, whether you're on the right or the left or somewhere in between, can imagine. And I ask people often to close your eyes and think about what it is or who it is that you love. Because I think it's a really important opportunity to ground us. And even though we may still go on our separate paths and I may not get them along with us, like I think reminding folks again that, we all we want is to offer our love and be loved in return, whether that's, with our community, with our children, with our, and so I think it's an important way to really think about how to affect change. And it's
Yeah,
very unusual for on the research side, and people are kind of like, "What is she talking about?"
but I mean, there's so much that I love about it. I mean, both of you guys are we could dig into the organization, and I'll wrap up a question with that. But with you, Simone, I love that you brought up voice, vision, value, which, Toya Randall and others, really the idea is that if and I think it's a little bit full circle of like, if we're not telling our stories, who is? And that, we are all navigating how to have strategies to have our full humanity be seen in workspaces. We are navigating competing priorities, sometimes very challenging realities within our communities, our families, our work lives, all of these things. And so how do we build a community of support, which I see very much rooted in love, that we don't always have to agree, but how do we build a community of support? And so I don't know if you have, as you are moving systems change work, and seeing it as just the basic humanity or relational or love. But if you want to add anything else into that, I would love to hear it.
Yeah, I mean, a couple of things. Talking about love and the humanity of people really makes me think about some of the work I've been doing through Greenlight Fund. In particular, our first program that we invested in called Let Everyone Advance with Dignity. Let Everyone Advance with Dignity, also known as LEAD, is a public health approach to community safety that starts with love. It starts with seeing people's humanity and their dignity, and then supporting them from there, understanding, ultimately getting to the root cause of their needs and sort of why they are where they are and how to help support them to move through that. But it really came out of talking to our community members in South Minneapolis on the Lake Street corridor after the murder of George Floyd, and saying, what are you experiencing? What do you need? And every person I talked to said, we have community members. They didn't say those people down the street or that homeless person or unhoused person. It was, we have community members who need support, and we want to be a part of a solution to help support them. And I found the LEAD program, as a result of those conversations, because it really gets to the root of what do you need as a person, as a human experiencing life, struggling with perhaps mental health issues or substance abuse challenges. But what do you need today? What do you need right now to help you make tomorrow better? And how do we build from there and really create a deep and meaningful relationship with someone in your life, with a case manager who can help you navigate through the long term? You never graduate out of that program. You will always have a place there to get support. And I think the more, and I should also add that, so this is a program that is responding directly to a need, but also there is a part of that work that is looking at this system that we all are existing in, and how do we change that system? How do we shape or modify or, restructure that system that isn't serving so many people in the right ways, so that we're not having to continue to put this Band-Aid on. And so I think the more that we think about programs that are rooted in love and dignity, the further we'll get, both from holding up and supporting individuals, but also changing the systems and the structures that we all sort of working through and trying to navigate through, but we know aren't working well, particularly for Black and Brown people.
Yeah, I wholeheartedly agree.
Can I add one thing?
Mm-hmm.
I was just going to say, I think, to your point, your comment, Shonda, I think we forget sometimes that love can include conflict, right? And it can include disagreement in the same way that we love our children, and we still are going to have conflict and disagree with some of the choices that they make. And I don't see a lot of professional settings where that is done well.
I agree.
I am like truly like learning how to do that right now, and how to think. And I think also our international conflicts right now, and looking at what's happening in the Middle East and Gaza, and with Palestine, has really forced some hard conversations. And I hope that we can learn sort of collectively how to sit in space and share space with each other, and perhaps, be in conflict, but also be humble enough to know that there isn't always just one way. And that, I always am looking and seeking to find people to work with and collaborate with, who aren't just yes people, who are going to challenge, my thinking on things, or push me to look at things in a different way. And that makes the work better. I think that I do worry, and this is maybe more of a tangent, but I do worry that, like, in Zoom culture and some of the other ways that we collectively get together these days, it doesn't actually facilitate that in the ways that I would like to, because I think that part of seeing someone's humanity and is sitting in front of them face to face. And even when I think about it with like the staff and the team I've been building for the past 2 years at the University of Minnesota, it's hard, because it is a really hard thing to achieve, but yet we keep kind of keep our eye on that North Star, that we can love the work, we can love each other, and we can also disagree and be in conflict and still move it forward.
Exactly. I mean, I tell people all the time, like, I appreciate that you're in agreement with me, but I will trust you more if you tell me what you're thinking.
Yeah.
Tell me what you think, and it doesn't have to be what I'm thinking. Yep. But I need to hear it. Mm-hmm. If people want to hear more on the work that you've got going on, Rachel, where would they go to find that information out? And then, Simone, I'll go to you.
Sure. So I am currently a professor at the University of Minnesota in the School of Public Health, where I'm the director of the Center for Anti-Racism Research for Health Equity. So if you're interested in learning more about our research, our mission and values, our team, you can go to CARE, CARHE, the H for health, care.umn.edu. Also, if you're interested in my work, my research, my speaking, the workshops and things like that I do, you can go to rachelhardiman.com to learn more there.
And then,
how about you?
Yeah, for Greenlight Fund Twin Cities, I am, as I've said, the executive director of Greenlight Fund Twin Cities. Greenlight Fund is a part of a national network. We have Greenlight sites and cities across 13 states and cities currently. I have the honor and pleasure of leading our work in the Twin Cities. To learn more, you can go to greenlightfund.org. You can learn about our national organization, but also read a bit more about what I'm doing in the Twin Cities. I mentioned the Let Everyone Advance with Dignity program, We also recently announced a partnership with a phenomenal organization called Earth. That's IRTH. They dropped the B for bias in birthing. Earth is an amazing organization helping to address the disparities that we see in Black maternal health. So the disparate outcomes that Black women and birthing people in particular are experiencing compared to their white counterparts. And another intersection of my sister's work and mine is that her research really fueled the efforts around finding and identifying Earth as a program that could respond to the needs that we were seeing through her research, but also from our Black and Brown community members who were saying, here are my experiences in health equity and birthing justice, and how can we help come together to respond in a way that will help shift this narrative and help change the disparities and the disparate outcomes. And so to read more and learn more about Earth, I encourage you to go to our website as well. Both organizations have an amazing presence in the community.
It really does. I've been seeing it everywhere. You have upcoming opportunity around Earth?
So we just hosted what was called Maternity House last weekend, which was an amazing opportunity to come out and support and learn more, but also experience Black birthing joy. We just hired a phenomenal local coordinator who will be putting on community events over these next few months. Earth also has a partnership with Hennepin Healthcare, which, as you know, is the largest safety net hospital, or the only and largest safety net hospital in the state of Minnesota. And what Earth will be doing with Hennepin Health is really helping them to identify where throughout their clinics and hospital system, Black birthing people are experiencing poor treatment and bias, and then helping them address it, putting a plan in place over the next 18 months to really address those experiences and respond so that outcomes can change, not just in Hennepin Health, but across our Twin Cities metro area, because we know once we address it for one group of folks, in particular Black birthing people, outcomes will start to change for everyone as well. And so our goal really with Earth is to also build more hospital partnerships with other hospital systems across the metro area as well. And so I really encourage folks to go out and learn more about the work that Earth is doing. They're rooted in community, and their work deeply starts with understanding what the needs are for Black birthing people and women, and allowing everyone to share their stories and their experiences as a way to hold our systems accountable and to create change. And so
your language is also powerful. So you are saying birthing people. Why that expansive language?
It's important to acknowledge that all people can be considered a birthing person or people, not just women. And so we want to be incredibly inclusive of those who stand in that system and want to consider themselves a birthing person. And so we Earth, not just Greenlight Fund, but Earth also is, and I would say CARE, the Center for Anti-Racism Research for Health Equity, is really intentional about ensuring that all people are included when talking about those who can give birth, and not just limiting that to people who identify as female or as a woman.
My last question. So I am 1,000% in support of women having a squad of people, right, that can cheerlead and be there. And you have the privilege of having a twin sister. You all are doing work. You've mentioned sort of the intersectionality of it. How have you guys been each other's cheerleaders and advisors throughout? I mean, I can imagine that it's endless, but it seems like the work is intersecting, and there's just something really special about how that is playing out and being able to witness it.
Yes, I feel so lucky. We are best friends. We are collaborators. We're co-conspirators. We, are constantly cheering each other on, whether in the background or, up front and externally. And it's a really special bond and relationship that we get to have. My sister is probably my first phone call in the morning and last phone call at night, whether that's, oh my gosh, do you know what my kid did today? Or help, here's what I'm dealing with at work today, and I need someone to lean on and talk through and think through this with me. We're constantly thinking up new ideas of how we can have an impact and get towards Black liberation. So stay tuned for more ideas coming from there.
I love it.
I feel so privileged and lucky every day to have the unconditional love and support from my sister.
Awesome. Thank you for being on the podcast.
Thank you. Appreciate you and all you do, and love the conversation.
To explore more insightful conversations and stay updated on Shonda Smith Baker's work, visit smithbaker.co.